Bloodborne Pathogen Exposure Control Training, Breakthrough ABA. Introduction: Why bloodborne pathogen training matters. At Breakthrough ABA, your safety is just as important as the care you provide to our clients. Whether you're working in the clinic, traveling to homes, or handling client materials, there's a possibility of coming into contact with blood or other potentially infectious materials. This training covers how to protect yourself and others from bloodborne pathogens, such as HIV, hepatitis B, and hepatitis C, in accordance with OSHA's bloodborne pathogen standard. What are bloodborne pathogens? Bloodborne pathogens are infectious microorganisms present in blood and certain body fluids that can cause disease. These include HIV, which causes AIDS, and hepatitis B and C, which affect the liver. While exposure is rare in ABA work, it can happen unexpectedly so, for example, during a first aid response, helping a child with a nosebleed, or cleaning up bodily fluids after a toileting accident. Understanding the risks and how to respond properly is critical. Modes of transmission. Bloodborne pathogens can be transmitted when infectious fluids come into contact with broken skin, mucous membranes, eyes, nose, mouth, or through needle stick injuries. While ABA therapists do not use needles, risks may arise from open cuts, human bites, splashes to the face, or handling soiled items like tissues, diapers, or clothing. Universal precautions mean treating all blood and body fluids as if they are infectious, always. Universal precautions. At Breakthrough ABA, we follow universal precautions, which means using appropriate barriers and behavior to reduce exposure risk. Always wear disposable gloves when dealing with bodily fluids, cleaning up after accidents, or touching any items soiled with blood. Dispose of gloves immediately in a sealed trash bag and wash your hands thoroughly. Never assume a situation is safe just because it looks clean. Treat every potential exposure with caution. Personal protective equipment, PPE. You are required to use personal protective equipment, PPE, when there is a risk of contact with blood or potentially infectious materials. This includes gloves, face shields, or gowns as needed. All PPE will be provided by Breakthrough ABA at no cost to you. PPE must be used properly, gloves should never be reused, and hands must be washed immediately after removal. If PPE is not available, pause the activity and alert your supervisor before proceeding. Exposure scenarios in ABA settings. Real-life scenarios in our work may include a child having a nosebleed during session, an RBT assisting with toilet accidents, or a therapist being bitten and the skin is broken. In each case, the therapist must use PPE, clean the area with approved disinfectant, and report the incident immediately. It's also important not to eat and drink or apply makeup in any client service area, as this increases contamination risk. What to do if exposure occurs. If you believe you've been exposed to blood or bodily fluids, 1. Immediately wash the affected area with soap and water. 2. Flush eyes or mucous membranes with water if exposed. 3. Report the incident to your supervisor within the same shift. 4. Complete an incident report form and follow medical evaluation procedures. You have the right to a confidential medical evaluation at no cost if exposure occurs. Don't wait. Report immediately, even if you're unsure. Exposure control plan and record keeping. Breakthrough ABA maintains an exposure control plan as required by OSHA, which includes policies, equipment, procedures, and follow-up steps. The plan is reviewed annually and is accessible to all employees. Training records, exposure incidents, and post-exposure evaluations are confidentially maintained. You will also be offered the hepatitis B vaccination series at no cost if your role has potential exposure risks. Your rights and responsibilities. You have the right to be trained, to receive proper equipment, and to report unsafe conditions without retaliation. You also have a responsibility to follow safety procedures, wear PPE when required, and immediately report any exposure or potential hazard. If you're unclear about your role or what precautions to take in a situation, ask your supervisor or contact the HR department. Safety is a shared responsibility. Your role as an ABA professional means caring for others, but you must also care for yourself. Following universal precautions, using PPE, and reporting exposures helps keep you, your clients, and your colleagues safe. If you have questions or need to request additional training or equipment, please contact Lori Ball, HR Manager, at lori.ball@breakthroughaba.com. Thank you for doing your part to ensure a safe and healthy workplace at Breakthrough ABA.